There was an interesting study on pitchers that came out. What a group was trying to do was identify pitchers in a major league system to see who was likely to get hurt. And what they did is at the end of spring training, they had the pitcher stand in the normal stance and then pick up 10 centimeters and come back down. They measured how much of a pelvic rock and tip they had. So the test was basically measuring how much stability they had in the pelvis, or the glute medius and hip stabilizer muscles. And then they tracked these players for 2 years. What they found were people who had the most amount of rock and wobble were the most likely to get hurt. The people who had the least amount of rock and wobble were the least likely to get hurt. So what that's suggesting is that some pitchers might be able to throw a great game, but they're just not stabilizing their hips like they should, which is probably leading to fatigue later in the game, which causes excessive stress and strain to be placed on other muscles and joints, namely the shoulder and elbow, leading to injuries. So by developing more lateral stabilization and strength, pitchers are able to A, generate more force, B, pitch longer before fatigue, but C, not put as much stress and strain on their shoulders and elbows. So we're going to go through stabilization exercises to help enhance that stability of the pelvis, but also increase your proprioceptive abilities, or the ability to balance in space, to know where your joints are at in space, that are critical for a pitcher to not only throw the ball, but also prevent injuries.